in continuation of early series of free camps, this today camp is for three important investigations, that is LFT, liver function test, HbA1c, that is glycated hemoglobin, and random blood sugar. The LFT, that is liver function test, is a test to assess the liver disease. It helps in diagnosis of the liver disease like viral hepatitis, in the progression of the liver disease like fatty liver or cirrhosis, how they are progressing, in the detecting severity of the disease, whether it is a severe disease, mild disease, and sometimes it also tests the side effects of certain drugs. Like if patient is put on ATD for tuberculosis, it tells about whether the drugs like rifampicin and INH are hepatotoxic or not. Now we come to individual tests, like as individual tests are AST, ALT, ALP, SGT, prothrombin time, and serum proteins, and bilirubin. So first we come to bilirubin. Bilirubin, that is a yellow pigment. This yellow pigment is released in the blood by hemolysis of the RBCs, and it is released in the bloodstream, and then further it is processed in the liver. In the liver, then it is secreted in the bile. Now the bilirubin can be direct, indirect, or sometimes both picture can be seen. Normally the bilirubin level is 0.3 to 1.2 milligram per deciliter, and most of this bilirubin is direct or conjugated bilirubin. This direct bilirubin is seen in viral hepatitis. It is raised in cholestatic jaundice, it is raised in bile duct obstruction, it is also raised in other cirrhosis also. Then indirect bilirubin is very less raised, but it is raised in indirect, that is hemolysis, as well as in neonatal jaundice and Gilbert's disease. This was about bilirubin. Second test which is done is AST, that is aspartate aminotransferase. Aspartate aminotransferase is also called SGOT, but this is not very specific. SGOT means serum glutamate oxaloacetate transferase, so the transaminase. This is not very specific test because besides liver injury, this is also seen in heart and in muscles of the body also. The normal values are 10 to 40 units per liter. Second test is ALT. The ALT means alanine aminotransferase, and it is also called SGPT, and this is a amino acid metabolism test. This enzyme converts this alanine into pyruvate. So this converts alanine into pyruvate. This is specific for liver, and if it is raised, it means there is a liver injury, and normal values are 7 to 56 units per liter. The third important test is ALP, that is alkaline phosphatase. Alkaline phosphatase is not specific for liver, but if it is raised, it means some liver disease, and also it is raised in some bone disease. The normal values of, and it is raised when there is obstructive jaundice, and that is when there is bile duct obstruction, and in alcoholic liver disease. So patients who are on alcohol, their alkaline phosphatase is raised. The normal values are 47 to 144 international units per liter. Then another test is GTT, that is glutamyl transferase. This gamma glutamyl transferase test is raised in patients who are on alcohol and in patients in bile duct obstruction. Now if a patient is having bone disease, then his GTT will be normal, but his ALP will be raised. Now another important test is total serum proteins. The total serum proteins can be assessed from liver LFT also. The normal value is 6 to 8.3 grams per deciliter, but among them albumin is most important, because albumin is the protein which is synthesized directly in the liver. The normal values are 3 to 5 grams per deciliter, and this is albumin is decreased when there is chronic liver disease, but it is also decreased in when patient is having low protein intake, when patient is having hypoproteinemia or in nephrotic syndrome. And last of the liver tests is the prothrombin time. So prothrombin time detects how our blood clots, how much time does the blood takes toward clotting, and it is because all of the clotting factors are synthesized in the liver, and the normal clotting time is prolonged if there is liver disease, but if patient is on some anticoagulant drugs. Now this was the first test. Second important test is HbA1c, which you are conducting today. HbA1c means how much the glucose is bound to the hemoglobin in the blood. Now this detects early diabetes, it detects the progression of the disease, and it is a most accurate test for detecting whether you are suffering from diabetes or not. Normal values are less than 5.7 is normal, 5.7 to 6.4 means patient is having pre-diabetes or impaired glucose tolerance, and above 6.5 means you are having clear-cut diabetes. The last test which you are conducting today is a random blood sugar. So now random blood sugar is a very vague test, but it is not more accurate than HbA1c or or fasting blood sugar. But it is very important in random conditions, like in emergency settings, in OPD settings like here. Now the normal values of random blood sugar are less than 149 is considered as normal, and that is random. And then if it is between 150 to 199, it is considered as impaired glucose tolerance or pre-diabetes, and more than 200 is clear-cut diabetes. Particularly if you are having patients with symptoms like weight loss, increased thirst, increased urination. So this is all a combination of all these tests which we have conducted today. All these three tests are early parameters, or that how we can detect early disease. But now after these tests, in subsequent series, we are going to conduct the all other investigations also, like the other investigations also, like the FibroScan camp and the bone mineral density test also.